Assalamu alaikum viewers and welcome back to my channel Denver's Hub. Today in the playlist of oral and maxillofacial surgery we will be discussing about the odontogenic infection and the spread of infection from the particular teeth. So first of all, we just need to know that if any of the particular teeth is infected, so which of the space will be most probably get infected or involved as a result of that odontogenic infection? So in order to understand that very well, we first need to know about the exit point of that infection, the muscle relation of that specific tooth or the exit point or the localization of the infection. So first of all, let us consider the example of maxillary incisor. In the case of odontogenic infection arising in the maxillary incisor, the infection will usually cause the perforation of the labial cortical plate. The exit point will be through the labial cortical plate because the distance of that infected root apex from the labial cortical plate is minimum and it is more closer to the labial cortical plate. Therefore, it is the path of least resistance, so the infection will exit out from there. Now, secondly, muscle relation. It is very much important to know about the muscle relation. In that particular region of the maxillary central incisor, we have the orbicularis oris attachment. And maxillary incisor, their roots, which were infected in that case, it is usually present below the attachment of the orbicularis oris muscle, which means that the infection will be contained or it will result in the vestibular abscess. After that, we have the lateral incisors. Now remember that lateral incisors do have a palatal the root have a palatal divergence in the palatal direction, so we will be considering that exit point as well. So first of all, if the infection from the lateral incisor, the root were near to the labial cortical plate, it will spread through the labial cortical plate, perforating it, and below the attachment of the orbicularis oris muscle we have the roots, so it will result in the vestibular abscess. And if the root it has a palatal divergence, so it will perforate the palatal cortical plate, and as no muscle on the palatal side is there, only mucosa will limit the infection, so it will result in the palatal abscess. In the case of lateral incisors, you have two possibilities: either the vestibular abscess, that will be as a result of the exit point is from the labial cortical plate, and another important point is the infected roots, they are below the attachment of the muscles, and the second possibility was the palatal abscess due to the palatal divergence of the root. After that, we have the maxillary canines. Now again, the maxillary canines, their roots are more nearer to the labial cortical plate, so it will perforate the labial cortical plate, infection will exit from there. And the muscle relation, so the muscle involved there is the levator anguli oris muscle. Here we have two possibilities. If mostly usually the roots they are below the attachment of the levator anguli oris, so again if the infected roots are below the attachment of the muscle, it will usually cause you vestibular abscess. The abscess or the infection will be localized out in the vestibular area. But if canine is very long rooted and the root that is the infected root apex, it is the above the attachment of the muscle, now it will cause the canine space infection, that is your infraorbital space infection as well in the infraorbital region. So we have two possibility, and most importantly these possibilities were as a result of differences in the location of the root apices in relation to the muscle attachment. After that, we have the maxillary premolar present. Now, maxillary premolar, again, their roots are nearer to the labial cortical plate, more possibility and probability that they will perforate, the infection will perforate the labial cortical plate and spread out from there. And as far the muscle attachments and relations are concerned, in that region we have the zygomaticus major muscle, zygomaticus minor muscle, and levator labii superioris muscle. So usually the roots of the premolar they are below the attachment of these three muscles, which again mean that infection or abscess will be contained in the vestibular region and will result in the vestibular abscess. After that, if any of the premolar roots they do have some palatal roots as well, and more probability that it will cause the palatal abscess as well. So for the buccal roots, we will be the chances to extend or perforate through the labial cortical plate, or if any of the palatal root is present, so it will also cause the palatal abscess. After that, we do have the maxillary molars. In the maxillary molars, again we have the two possibilities, that either exit will be through the labial cortical plate. In that case, the infected root will be nearer to your labial cortical plate. So the muscle attachment present out there is the buccinator muscle. Again, two possibilities. If the infected root apex is below the attachment of the buccinator muscle, vestibular abscess will result, means the infection will be contained in the vestibular region. But if the roots are long and they are above the attachment of the buccinator muscle, it will result in the buccal space infection. After that, if any of the palatal root of the molars they get infected, they will usually the infection will exit to the palatal cortical plate and will cause the palatal abscess. So this was all about the spread of the infection from the maxillary teeth. I hope this video will be helpful for you all. Don't forget to subscribe to my channel for more videos and updates. Thank you.